Every year, on June 26th, the world comes together to observe the International Day Against Drug Abuse and Illicit Trafficking, a powerful global initiative established by the United Nations in 1987. This day is not merely symbolic. It is a firm reminder of our shared responsibility to fight against the global drug crisis that devastates millions of lives each year. In 2025, the observance carries the theme, Breaking the Chains: Prevention, Treatment and Recovery for All. This theme emphasizes a holistic approach, a shift from punishment to prevention, from stigma to support, and from despair to recovery. As nations grapple with growing addiction rates, the rise of synthetic drugs, and the deep-rooted criminal networks behind trafficking, this day becomes a rallying call for governments, communities, and individuals to act with urgency and empathy. The International Day is not arbitrarily chosen. It commemorates Lin Zexu, a Chinese scholar and official known for his dramatic stand against the opium trade in the 19th century. His destruction of 1,000 tons of opium on June 25, 1839 in Human, Guangdong, sparked the First Opium War, but also etched his name into history as a pioneer of anti-drug action. In many ways, his courage mirrors today's need for global, unified efforts. According to the UN Office on Drugs and Crime, over 296 million people globally used drugs in 2021, 23% increase over the previous decade. Opioids, including heroin and prescription pain relievers, account for 2/3 of drug-related deaths. The synthetic drug trade, particularly fentanyl and methamphetamine, is surging with devastating consequences. Only 1 in 8 people who need treatment for drug use disorders actually receive it. In 2025, the figures are expected to be worse. The COVID-19 pandemic, geopolitical conflicts, economic downturns, and rising mental health issues have all contributed to the growth of addiction and trafficking networks. Breaking the chains: prevention, treatment, and recovery for all. This theme reflects a compassionate, inclusive, and strategic framework for solving the global drug crisis. Let's break it down. Breaking the chains. This is both metaphor and reality. Addiction is a chain, emotional, chemical, and often social, that binds the user. Illicit trafficking is a chain that enslaves children as mules, women as couriers, and entire communities as consumers or suppliers. Evidence-based prevention strategies save lives and reduce drug initiation, especially among youth. Prevention involves school-based education, parenting programs, public awareness campaigns, and mental health interventions. Treatment must be accessible. We need to remove the stigma and ensure affordable care. It should be holistic, including detoxification, behavioral therapy, group support, and medical care. And let's not forget, recovery is a lifelong process, not a one-time cure. Inclusivity is key. Marginalized populations, prisoners, LGBTQ+ individuals, indigenous communities, and displaced populations are often neglected in recovery programs. The slogan calls for universal access to recovery support. The UNODC, or United Nations Office on Drugs and Crime, plays a central role in coordinating global efforts to reduce the supply and demand for illicit drugs. Its goals include monitoring drug trends via the annual World Drug Report, providing technical assistance to member states, supporting alternative development to help farmers replace illicit crop cultivation like opium poppy or coca, and promoting international legal frameworks against trafficking and organized crime. In collaboration with the World Health Organization, Interpol, and civil society organizations, the UNODC continues to champion a balanced and humane approach that respects human rights and public health. Young people are particularly vulnerable to peer pressure, anxiety, and misinformation. According to UNESCO, school-based drug education is one of the most effective tools for prevention. Effective youth strategies include integrating drug education into school curricula, empowering peer leaders, using digital platforms to spread awareness, and promoting extracurricular engagement to build life skills. A major innovation in 2025 has been the introduction of AI-powered chatbots in schools that provide real-time support to teens experiencing mental health or substance use issues. The global drug trade generates over $400 billion annually. This money feeds terrorist organizations, paramilitary groups, cartels, and human traffickers, from the poppy fields of Afghanistan to the coca jungles of Colombia, and from the labs in Eastern Europe to dark web marketplaces. The drug economy undermines governance, law, and peace. Women and children are often exploited as couriers. Drug dependency is sometimes created intentionally to control victims. In some parts of Asia and Africa, entire families are entrapped into cycles of trafficking due to poverty and coercion. The rise of cryptocurrency, encrypted apps, and anonymity networks has made drug buying shockingly easy. Today, synthetic drugs like fentanyl are sold online, shipped across borders in envelopes, and often result in fatal overdoses within hours. Key synthetic drug challenges include fentanyl, which is 50 times more potent than heroin and causes hundreds of thousands of deaths annually. Methamphetamine is inexpensive, highly addictive, and spreading fast in South and Southeast Asia. And then there are new psychoactive substances, or NPS, which are constantly evolving to evade regulation. The UNODC Synthetic Drug Strategy 2021-2025 focuses on disrupting these supply chains using AI-powered surveillance, cross-border intelligence sharing, and forensic monitoring. It's easy to feel overwhelmed by statistics, but the spirit of this day is rooted in hope. All over the world, people are rebuilding their lives through counseling, community support, skill training, and therapy. For example, in Portugal, decriminalization and investment in treatment saw drug-related deaths drop by 90%. In Punjab, India, community rehab centers supported by village councils are helping thousands fight heroin addiction. And in Colombia, ex-coca farmers are now coffee entrepreneurs thanks to the UN's alternative development programs. These stories remind us addiction is treatable, recovery is real, people matter. Families are the first safety net. Open dialogue, trust, and early intervention can prevent the spiral of addiction. Community centers, religious groups, and local NGOs can host awareness workshops, facilitate group therapy, provide shelter and skill-building programs. In 2025, many countries are also promoting peer-led rehabilitation, where former addicts serve as mentors. 1. Health-based approach. Shift drug control from the police station to the health clinic. 2. Legal reform. Reevaluate punitive drug laws and adopt humane alternatives. 3. Data-driven strategies. Use national surveys and big data to design targeted interventions. 4. Global cooperation. Share intelligence, align laws, and co-finance anti-trafficking missions. 5. Youth engagement. Allocate budget for school programs and youth mental health services. You don't have to be a policymaker to make a difference. Here's how individuals can help. Educate yourself and others about the realities of drug abuse. Volunteer at local de-addiction centers or helplines. Support rehabilitation initiatives through donations or service. Report trafficking or abuse through anonymous channels. The International Day Against Drug Abuse and Illicit Trafficking. 2025 is not just about awareness, it's about action. It's about breaking the silence, breaking the stigma, and most importantly, breaking the chains. Addiction is not a crime. It's a public health issue. Trafficking is not a distant problem. It's a threat to humanity. Recovery is not impossible. It's happening every day, in every corner of the world. Let this day serve as a reminder that whether you are a policymaker, parent, teacher, student, activist, or simply a concerned human being, you have a role to play. Together, let us build a future where every individual has the right and opportunity to live free from the horrors of drug abuse and trafficking.